Tips to live better with Crohn's disease. Tip 1. Start with the basics. Most people with Crohn's disease find that they feel better if they eat small amounts more frequently throughout the day rather than several large meals. Avoid greasy or fatty foods, especially fried dishes. Cut down on milk and dairy products, which can be difficult to digest. Limit high-fiber foods and those that are more difficult to digest, like popcorn, seeds, and nuts. Tip 2. Work with a dietitian or nutritionist. You may want to avoid certain foods or food groups that you know exacerbate your symptoms during flares. However, when you eliminate entire food groups from your diet, you run the risk of malnutrition. A nutritionist or dietitian can help you create a nutritious meal plan that avoids the foods that bother you. Tip 3. Limit caffeine. Like alcohol, caffeine can aggravate some Crohn's disease symptoms, including diarrhea. Caffeine is in coffee, tea, chocolate, and some sodas. Carefully read the labels of foods and beverages you buy to check for caffeine content. Caffeine before bed also can interfere with sleep, so if you drink caffeine, be sure to stop early in the day. Tip 4. Stick to your treatment plan. You may want to skip your medications when you are feeling better, but you risk a flare if you do. It is important to take your medications according to your doctor's directions. Tip 5. Avoid over-the-counter anti-inflammatory drugs. Many people with Crohn's disease also have arthritis and may want to take a non-steroidal anti-inflammatory drug, such as ibuprofen or naproxen, for the pain. But over-the-counter medications, aside from acetaminophen, are generally banned for Crohn's disease. Another reason to avoid these pain relievers: they can cause ulcers in the lining of your intestines. Tip 6. Be careful about antibiotics. Antibiotics can sometimes cause Crohn's symptoms to flare. Tip 7. Protect against bone loss. Crohn's disease and some of its treatments can increase your risk of developing osteoporosis, which makes bones weak and fragile, increasing the risk of fractures. Talk to your doctor or a nutritionist about how to get enough calcium, vitamin D, and any other nutrients in your diet to help keep your bones strong. Tip 8. Get screened for colon cancer. Having Crohn's disease increases your risk of developing colon cancer, so it is important to have regular colonoscopies to check for any signs of the disease. Tip 9. Get immunized. To stay healthy, consider being vaccinated against the flu, pneumonia, and human papillomavirus, as well as hepatitis A and B. Tip 10. Start a journal. One way that helps many people with Crohn's disease manage their lives better is by keeping a journal. Include what you eat, when you exercise, when you experience stress, and anything else that affects you and your Crohn's disease symptoms. Tip 11. Check in with your doctor regularly. If you are feeling well, you may only need to see your doctor twice a year. But if you are experiencing flares frequently, you may need to schedule an appointment more often, possibly to adjust your treatment. Never change your medication dosage, scheduling, or any other aspect of your health plan on your own. This could have dangerous results. Click the link below or follow this link https://askthenurseexpert.com/categories/Crohn's-disease for more tips to live better with Crohn's disease.